First of all, I have to admit that we are now navigating in something that is completely new. The science of the long-term consequences of infection by COVID is just emerging just because we have been experiencing the COVID for the last 2 years, and then what it could be the long-term consequences of the disease, in particular from the neurological point of view, are going to be receiving a lot of attention, especially in view of the fact that almost 40–50% of the population or subjects that survive COVID, they report kind of symptoms that are mostly neurological associated, in particular condition associated, for example, to cognitive impairment. What they actually also a condition is called brain fog, and it has been very well determined now that probably worldwide, almost, and in particular in the USA, about, I would say, 30–40% of the people post-COVID, actually they have some kind of complication from the neurological point of view. So this has been the reason why our center, and in particular from the translation center that I'm directing, I try to identify potential mechanism and eventually to try to identify biomarker that we can eventually use to move forward the attenuation, to identify if there is potential therapeutic approach or something that we can do to attenuate the complication that sooner or later in the next 10 years, most of these people affected by COVID might eventually develop.